about dislocations, and that word dislocate refers to when basically the bones come out of alignment and are one of the ways that we can screw up our joints. Other ways we can screw up our joints are tearing the cartilage, a sprain, in which case we stretch or tear our ligaments. And the problem with both of these types of injuries is that cartilage is actually avascular, and the dense regular connective tissue that makes up our ligaments, whilst they do have some blood vessels, don't really have a great number of blood vessels, and so they don't repair very, very well. When I tore my ACL, they were like, well, you have two options. You can, leave it and just do some physical therapy and strengthen the surrounding muscles, or we can replace it with arthroscopic surgery, which is what I ultimately opted for, where they basically just use a little camera to kind of replace or repair the ligament or the cartilage. So the other word for dislocation is luxation. Again, this is when the bones come out of alignment. Anytime you dislocate a joint, you're going to stretch or tear some ligaments. There's always going to be lots of inflammation, kind of swelling, a lot of pain. The joint becomes very difficult to move, and typically, these kinds of injuries are due to some sort of trauma. You can have what is called a subluxation, which is kind of a partial dislocation, where the bones aren't like completely out of alignment, but maybe just a little bit out of alignment. But whether it's a full dislocation or just a partial, they're going to reduce it. They're going to immobilize it. They're going to give you some pain meds. They're going to give you some ice. They're going to put the bones back into place, and just let you not put any weight on it as much and treat the inflammation and the pain until it all goes down, and then the bones will kind of go back into their proper place. We can have some kind of inflammatory conditions, so itis. What you're seeing here is bursitis. It's when the little fat pads, those bursa, get inflamed. Typically this is caused by some sort of trauma, and again, it's kind of what we call RICE, rest, ice, compression, and elevation. Very common way to treat these kinds of injuries. You can also have tendonitis, which is when you actually inflame those tendon sheaths. Tendonitis is usually caused by overuse. So if you particularly use one joint all the time, say you're a typer and you're always at your computer, then that's one of the ways that you can get tendonitis. They're painful. Anytime you have this kind of this inflammatory process, it's pretty painful. The last of the conditions we're going to look at is arthritis. Arthritis is really about several different, over 100 kind of collectively clumped together as this kind of generic set of symptoms. So that those include pain, stiffness, and swelling. So you can see in this X-ray here, you can see just how misshapen these interphalangeal joints have become because of an arthritis, which is degenerative. Once you get arthritis, it gets progressively worse. Now, if you've ever had or if known of anybody with Lyme's disease, which is caused by a bacterium in the deer ticks, that can cause acute cases of arthritis, but the two more common forms of arthritis are the two chronic forms that basically once you have, and you can't deal, and you can just treat the symptoms. You can't cure them. Like if you get acute arthritis, if you get Lyme disease, they'll give you antibiotics and your arthritis will go away. But if you have osteoarthritis or rheumatoid arthritis, then you're pretty much going to deal with it forever. So osteoarthritis is the most common. It's our wear and tear. Pretty much all of us will likely have it when we're older. It's very much a normal part of aging. We think that it's actually that the cartilage, the articular cartilage, is breaking down. And so the joints are getting kind of more inflamed. One of the ways they diagnose osteoarthritis versus rheumatoid arthritis is that osteoarthritis, OA, will typically only be on one side of the body, and particularly particularly in areas where you've previously injured a joint. So I tore my ACL in my left knee. I am very likely to have osteoarthritis in my left knee when I am older, as opposed to in my right knee, which is not damaged. Conversely, rheumatoid arthritis, because it's an autoimmune disease, so instead of it being kind of normal aging wear and tear, it's your body's own immune cells are kind of attacking your joint tissues, and so people who have rheumatoid arthritis are much more likely to experience the arthritis, the pain, the swelling on both sides of their body, so bilaterally in both knees, in both hands, and so on and so forth, as opposed to just in one side. It's also usually accompanied by osteoporosis, weak muscles, cardiovascular problems. Again, because this is an autoimmune disease, it's your own body's immune cells are like attacking your body. In either instance, whether you have RA or OA, if the arthritis gets to the point where it's crippling you, they can replace the joint with a prosthesis. This is a shoulder prosthesis. So, and they've made great strides with prosthetics in recent years. Really, when it comes to keeping our joints healthy, it's mostly about doing full range of motion. As we age, the ligaments, the tendons get weaker. You're much less likely to kind of blow a disc in your back, herniate one of your invertebral discs, and almost all of us are going to have some osteoarthritis when we're older. But if you put your joints through as much kind of full range of motion, so don't just stretch a little bit, go from 0 to 90, do the full flexion, full extension, full rotation, abduction, adduction. That's really one of the best ways to keep your joints healthy. Yoga is great for that kind of stuff. Being in a pool, whilst swimming is not great for osteoporosis because it doesn't put any stress on your joints and on your bones, so they don't get any stronger. Swimming and things like that are actually great for this kind of stuff because you're working your joints out, but you're not really putting a whole lot of stress on them. So that is the end of chapter 8.